Hello class, welcome to our guide on working safely in a Class 2 Type A2 Biosafety cabinet. In this video, we will deep dive into topics to ensure the safety and integrity of your work. A Class 2 Type A2 Biosafety cabinet is the most common type of cabinet used in the industry and the ones we have in our lab. These cabinets provide a controlled environment for handling biohazardous materials. It protects the user, the product, and the environment from microbial exposure.
Daily BSC operations.
First, we will wash our hands for at least 20 seconds with soap to remove any potential contamination deriving from our skin. Before starting the process, it's crucial to wear the appropriate personal protective equipment, or PPE. This will include a lab coat to protect your skin and clothing, double glove and sleeve covers to prevent contact with hazardous materials handled, goggles to protect your eyes from splashes, and hairnets.
Things to avoid when not wearing your personal protective equipment.
Some things to avoid when wearing your personal protective equipment are: remove earrings, jewelry, rings, and long acrylic nails, since we don't want anything that could possibly fall off or that can tear the personal protective equipment. Avoid wearing loose clothing, bulking, or revealing. It is recommended to wear fitting clothing that covers the skin from hazardous materials and spills, and preventing the skin itself from compromising the integrity of the process. Avoid touching your skin after putting on the sterile protective equipment, since this will compromise your aseptic technique.
Here's a quick demonstration of how to put on your gloves and sleeves. Remember to tuck in the cuff of the sleeve covers inside the second pair of gloves.
We will be initiating our cleaning by bringing the window sash to work position and allowing the air to flush into the work surface for a couple of minutes while we are gathering our materials for our cleaning. For ergonomic purposes, we use a stainless steel flat mop tool to reach all surface areas inside the BSC. We will also gather a mop tool cover, alcohol wipes, and a cleaning tray. We must make sure to completely submerge the mop head onto the tray, ensuring full saturation of the mop. Begin by fully raising the window sash to have completely access to the interior of the BSC. And we will proceed to clean the BSC to the following cleaning pattern. Starting with the back wall, we will wipe from top to bottom unidirectionally with overlapping passes. Remember to saturate the mop tool often to avoid dryness. Then we will move to the side walls. Also from top to bottom, we will clean moving from back to front. After cleaning both side walls, we will lower the sash to the work position and clean the interior surface, wiping unidirectionally from top to bottom. We will then clean the interior floor of the BSC, working from back to front. We will then clean the exterior of the sash using unidirectional strokes. We will then wipe the air vent unidirectionally using an alcohol wipe or a dedicated mop. Finally, we will clean the armrest with an alcohol wipe. Allow a 5-minute contact time after cleaning. While waiting, gather the necessary materials for your operation. Starting with recording in the logbook all the information about the process to keep it traceable. In here, we will document the time, date, operations, reference used like batch records or SOPs, operator initials, and any comments about the operations.
Things to avoid when passing dot materials into the BSC.
Avoid overcrowding and blockage of airways to keep airflow. And do not enter any containers or materials that have been previously opened. Avoid rapid movements that can disrupt the airflow and introduce contaminants. Do not pass over any open containers since this will disrupt first air.
Also, remember to always place caps facing down over an alcohol wipe.
Establishing a clear workflow is essential for efficiency and safety throughout the process. To keep a sterile environment inside the BSC, we must follow certain parameters. Organize materials as they are passed in. Accommodate them in a place and position that is most comfortable for the operator. If you are left-handed, the left side will be your clean side, and if you are right-handed, vice versa. Avoid crossing your hands to reach for materials. This can cause microbial spread. Do not touch the tip of the pipette with the exterior or interior of the containers. For support operators, avoid reaching too far inside the BSC when passing materials in, especially when containers are open. Avoid waste accumulation inside the cabinet. Despite our best efforts, deviations can occur. It is important to recognize and address them properly. Common deviations include: if the BSC is not functioning properly, stop working immediately and notify your supervisor. If contamination is suspected, follow your facility's protocol for reporting. If gloves are tear, stop working immediately. Close all open containers and come out of the BSC to replace both sleeve and gloves. Remove all materials used inside of the BSC and proceed to initiate cleaning just as demonstrated at the beginning of the process. Do not forget to register in your logbook your end time. By following this guideline for working safely in a Class 2 Type A2 biosafety cabinet, you can protect yourself and ensure the integrity of your work. Remember, safety is a shared responsibility.